software startup and main screen. Double-click the SpiroPower icon to start the pulmonary function test software. Enter the username, password, then enter the main screen. The horizontal row of the main interface is the primary menu, including patient information, calibration, and various test categories. And the vertical row is the secondary menu. Click the left mouse button to activate the primary menu, and then double-click the left mouse button to enter the secondary menu. BTPS calibration. Automatic BTPS calibration. Manual BPTS calibration. Click on the Edit button to make changes. Then click Save. Zero calibration. Click the Zero calibration button to process zero calibration. After the zero calibration, pop up the reminder. The software will automatically perform zero calibrations when saving patient information prior to each measurement. Volume calibration. Set pipe diameter before calibration. Select different volume of calibration syringe. If the standard mouthpiece 2 is selected, install the mouthpiece to the ultrasonic sensor. Connecting 3-liter calibration syringe. Ensure without leakage. Click on Start and slowly push and pull the calibration syringe at a constant speed within the selected pipe diameter flow measurement range. Automatically saves the calibration coefficients. The calibration result data is displayed at the bottom of the screen. If the standard mouthpiece 1 is selected, install the mouthpiece to the sensor. Connect the 3-liter calibration syringe to ensure no air leakage. Perform the calibration action. If the M-size mouthpiece is selected, install the mouthpiece to the sensor. Connect the 1-liter calibration syringe to ensure no air leakage. Perform the calibration action. If the S-size mouthpiece is selected, install the mouthpiece to the sensor. Connect the 100 ml calibration syringe to ensure no air leakage. Perform the calibration action. Volume calibration verification. Same as volume calibration, if calibration is validated successfully, the software does not save the calibration coefficients. Flow sensor linearity calibration. Set the pipe diameter before setting the calibration. Select a different volume calibration syringe. Connect the calibration syringe to the sensor. Ensure no air leakage. Click on Start. Slowly push and pull the calibration syringe at a constant speed within the displayed flow range. The calibration data will be displayed in real time. The calibration end prompt box will pop up. If successful, then go to the next flow rate interval. If the calibration fails, please check the reason and perform the calibration procedure again until the calibration is completed. The calibration results are displayed at the bottom of the screen, and the calibration coefficients are not saved. DLCO gas source calibration. Open the cylinder. Make sure the pressure in the cylinder is greater than 10 bar. Adjust the pressure reducing valve to make outlet pressure of 3 to 4 bar. Remove the pipe connection to the sampling port and connect it to the calibration port on the sensor base. Enter the gas concentration values on the calibration cylinder into the software and should be re-entered each time the cylinder is changed. The recommended standard gas concentrations are carbon monoxide 0.3%, methane 0.3%, oxygen 21%. Click Start. Automatically start to calibrate the gas source until the end. The calibration result data results are displayed below. Diffusion biometric calibration. Same as the diffusion residual gas module, single breath test, regular verification of the diffusion test results by the same operating physician to observe whether there are any significant deviations in the data results. Mouth pressure calibration. Firstly, SpiroPower system will perform self-test, then enters the calibration screen. Use the connection hose to connect the calibration syringe to the unit's mouthpiece. The rear end of the line is connected to the filter tube. After clicking Start, push and pull the calibration syringe at a constant speed in the flow range of 1 liter per second to 3 liters per second until the calibration is completed. Missed rate calibration. First, start self-check, then enter the missed rate calibration screen. Fill the nebulizer cup with a certain amount of saline for weighing, recorded in the start weight. Connect the nebulizer cup to the line and place it on the hanging cup port. Click the Start button. Automatic stop after 2 minutes of fogging. Remove the nebulizer cup and weigh it again and record it in the end weight. Repeat the test 4 times. The system automatically calculates the fogging rate and displays parameters such as the fogging rate. Patient information. Patient data. Enter the patient's information in the test number or name box and click on the Search button. The search results on the right side of the screen displays the current patient's information. Double-click on the patient's information to select the current patient and perform the measurement, and display the patient's past measurements history. New patient. Enter the patient's information, filling the basic information completely and accurately, filling the details optionally, and click the Save button to save the current new patient record. The predicted value is calculated from the patient's information. The system will calculate the predicted value based on the patient data during the saving process. Automatically zero calibration after save. Spirometry. Forced spirometry. Entering forced spirometry screen. First, select the breather line used for the test. Connect the F mouthpiece to the filter. Insert the F mouthpiece 1 into the ultrasonic sensor, accurate location. Click the Start button, instruct the patient how to carry out the test and what is expected. Instruct the patient to breathe regularly and steadily for a while until the breathing level FRC level is stable. This usually requires at least 3 tidal breathing maneuvers. Instruct the patient, quicker and faster, to inhale completely until TLC level is reached. Then the patient should exhale forcefully and completely until RV level is reached. Expiratory timing and end expiratory flow display, real-time observation to measurement quality control, followed by a complete inhalation until TLC level is reached again. Click on the stop button to end the measurement. Displaying test results, curves, and test data. Parameters and related information can be selected for display, and the software has intelligent quality control and grades for the acceptability of single tests and the repeatability of multiple tests, and quality control conditions can be switched. Repeat the test at least 3 times. Tidal breathing analysis. First, select the M or S breathing line according to the age of the patient. In the setting menu, the deviation of the variation rate and the number of acceptable breathing rings can be set, and the measurement procedure will automatically end after the set parameters are met during the measurement. Right insert the mouthpiece into the sensor. Connect the mask to the breathing line to ensure that the connection is airtight. The patient breathes calmly, places the mask over the child's mouth and nose, ensures air tightness, and then clicks start. The software displays the tidal breathing parameters in real time, manually end the measurement, or automatically when the requirements are met. Parameters and related details can be selected for display, and the software has intelligent quality control and grades for the acceptability of single tests and the repeatability of multiple tests. In the results screen, the operator or practitioner can adjust the acceptable breathing loop via the edit function, and the software automatically recalculates the corrected measurement based on the adjustment. Repeat the test at least 5 times. MVV. Select the breathing line. The F breathing line 2 needs to connect the filter. Right insert F mouthpiece 1 into the sensor. Clicking Start. Patient should breathe as deeply and as rapidly as possible over a period of 12 to 15 seconds. The test will automatically stop. Parameters and related information can be selected for display, and the software has intelligent quality control and editable. Repeat the test at least 2 times, with a recommended test interval of at least 10 minutes. Slow spirometry. Select the breathing line. The F breathing line 2 needs to connect the filter. Right insert F mouthpiece 1 into the sensor. Instruct the patient to breathe regularly and steadily until the breathing level is stable. When the stable FRC level is reached, the patient should inhale completely until the TLC level is reached. Then the patient should exhale fully until RV level is reached. The expiratory timing and end expiratory flow will be displayed on the screen. Real-time observation for quality control of tests. After a period of tidal breathing, the maneuver is completed. Parameters and related information can be selected for display, and the software has intelligent quality control and grades. For the acceptability of single tests and the repeatability of multiple tests, and quality control conditions can be switched. Repeat the test at least 3 times. Bronchodilation test. After completing the spirometry measurement, inhale a bronchodilator and wait for a period of time, the time to wait being determined by the inhaled drug. Enter the bronchodilation test screen and select the previous spirometry test results as the pre-drug comparison item. The test procedure is identical to the spirometry test, and changes in non-function pre-post drug are shown in the graphs and the parameters. Quantitative provocation test. Self-testing of device. Click on the air tightness test button. After the air tightness test is complete, click on the water removal button. Unplug the nebulization line and remove the water from the line until there is no visible liquid in the line. Then insert the line back into the nebulization cup. In the protocol management screen of the provocation test, select the dosing protocol, either the default protocol or a customized protocol. Select the dosing mode as quantitative and the test mode as forced spirometry. Click on the Start button. Instruct the patient to perform a deep breathing maneuver to inhale the provocation liquid. At the end of the inhalation, instruct the patient to perform spirometry measurement. At the countdown, the provocation liquid is changed to the next concentration in the dosing protocol, and the provocation liquid inhalation is performed again. Then perform spirometry step. Start the inhalation of the provocation liquid at a low dose. If the key parameter decreases by more than 20% from the reference value, or if the patient develops significant discomfort and clinical symptoms, select the dosing protocol last step. The patient inhales the bronchodilator drug and waits for a period of time. Instruct the patient perform the spirometry test. Click on the Settings button. Select the manual dosing of provocation drug in the provocation test options. Check the dosing protocol in the protocol management screen of the provocation test. Choose either the default protocol or a customized protocol and select the test mode as tidal breathing. Click the Start button to enter the tidal breathing screen. The patient first start tidal breathing test. Perform a 2-minute tidal inhalation of the stimulant through the nebulizer. Then start tidal breathing test again after inhalation. After the countdown on this interface has finished, start to perform the next provocation test. Start the inhalation of the provocation liquid at a low dose. If the key parameter decreases by more than 20% from the reference value, or if the patient develops significant discomfort and clinical symptoms. Select the dosing protocol last step. The patient inhales the bronchodilator drug and waits for a period of time. Instruct the patient perform the tidal breathing test. CO diffusion test. Single breath CO diffusion. The system SpiroPower gas analyzer requires a warm-up time of 20 minutes before the first test can be carried out. Then performs CO diffusion test. In the settings panel that pops up, select and set the gas hold time, gas hold calculation method, and oxygen fraction of the test gas, and click on the OK button. Enter the measurement interface. Connecting the sampling tube from the sensor base to the sampling port. Click Start button. Instruct the patient to breathe regularly and steadily until the breathing level is stable. The gas button CO becomes active. Instruct the patient to fully exhale completely RV reached. During the exhalation, click on the CO gas button. Instruct the patient to fully exhale completely and then to inhale a single breath as quickly and fully as possible, and then to hold the breath for 10 seconds. The screen displays a countdown timer with a beep. Instruct the patient to exhale and breathe normally. Parameters and related information can be selected for display, and the software has intelligent quality control and grades for the acceptability of single tests and the repeatability of multiple tests. In the results screen, the operator or practitioner can adjust the length of the expiratory to plateau period via the edit function, and the software can automatically recalculate the corrected measurement based on the adjustments. Test results review and comparisons. In the patient management screen, click on the name in the patient's past test record. Enter the test results screen to review past test results. Select a test item in the past test record as a reference. Click on the test comparison button. A pop-up box will appear. Then you can select a number of other tests to compare the data. The screen will display the comparison results of the selected item. Test data export. Click on the Data Export button on the main screen to open the Data Export box. Enter your search conditions and click on Search. The patient's information that matches the condition will be displayed in the search box. Select the items to be exported and click on Export. The selected test items will be exported to an Excel file and will open automatically. Test evaluation. If you want to make a comment on the report, click on the Conclusion button and input the details in the conclusion box. Click on the OK button to save and exit. When the report is opened, the saved evaluation is applied. The individual functional test screens have the current test report conclusions. The comprehensive report conclusions are available on the patient management screen. Test reports. Two methods to preview the test report. Test interface. Click on the Print button in each function screen to preview the test report for the current function. Patient information screen. Go to the Patient Information function and click on the Print button in the function screen to bring up the Print Report pop-up box. Select a report to preview.